question is, perform, you have a conscious patient suffering from choking or foreign body aspiration. Perform back blows and abdominal thrust. Perform back blows and abdominal thrust. The victim must be leaning forward like this, and you have to put your hand in front of him so as he will not fall, okay? Leaning forward like this. And then, with the palm of the hands, we have to perform back blows, 5 back blows. The foreign body may come out or may not, okay? Then, after back blows, I have to do abdominal thrust. I am behind him, putting the fist of one hand here and the other above it and forward. Yes, okay? Please. Okay? 5, okay? If I perform 5 back blows like this and 5 abdominal thrust. You have to hear the sound of air coming out so as to push it out. Okay? This is the correct method, and you do it without speaking or talking anymore. Okay? Okay. Now, to perform, if the patient is unconscious, must be on the ground, but we will do it here. The patient is unconscious with foreign body aspiration. I will do back blows and abdominal thrust. For back blows, I bring him to the side like this and preventing him from fall. And then 5 back blows, then put it like this and do 5 abdominal thrust. Okay, like this. Okay, this is a maneuver for back blows and abdominal thrust if the person is conscious or unconscious. Okay. Now, how would you perform intramuscular injection? And what are the sites for intramuscular injection? The sites are upper lateral quadrant, like this. This is 4 quadrants, upper lateral quadrant, so as not to injure the sciatic nerve, okay? Not to injure the sciatic nerve. Or the anterior lateral aspect of the thigh, like this, anterior and maybe posterior. The lateral aspect of the thigh, so as to be away from the femoral here, okay? And maybe in the deltoid muscle, which is divided into 3/3, and I will give in the middle third, okay? The side. Middle third of the deltoid, upper lateral quadrant of the gluteal region, here, or the lateral aspect of the side, okay? Here, lateral aspect of the side. How to perform now? The question is, give the patient intramuscular injection. Good morning, I am Dr. Nakwa. I will give you an intramuscular injection. It will not harm you. And then you have to wash your hands like this. I'm washing my hands, okay? Then I will take the syringe and remove the cap. This is a syringe. I have to remove the cap. Okay. Put it in the ampoule till the needle touch the bottom, and I withdrew the drug, the exact dose prescribed to the patient. Okay. Then I will expel air if there is excess air and recap it again. Okay. Then with a piece of cotton, we will put you cotton with a piece of cotton and alcohol. You will take the cotton and the alcohol. Then, in a circular movement, I will disinfect. Starting, I will bring it like this, okay? So as every one of you would see. So this is the region, the upper lateral quadrant of the gluteal region. Then I will inject here. So in a circular movement, starting from the middle and disinfecting a circle about 5 centimeters. Then I will take the syringe, removing the cap, and stretching the skin. Stretching skin like this. And 90 degrees, I will, yes, and I will introduce the needle, and I have to withdraw the plunger so as to be sure that there is no blood. There is no blood. No blood, then I will inject in stage 1 shots, and then I have to take it out, press with cotton, and don't recap again and discard it. Don't recap again after finish. Okay? The question is, what are the sites of injection of intramuscular? Sites, as I told you, upper lateral quadrant, lateral side, lateral aspect of the side, and middle third of the deltoid muscle. Okay? The other question, if blood is withdrawn, what will you do? I will remove the syringe and the needle, discard the needle, use new sterile needle, and choose another site for intramuscular injection. Okay? How can I give the last question is give subcutaneous injection. In this condition, what are the sites? The abdomen, the deltoid, and the thigh, and the side, the front of the side. Okay? How can I do it? Good morning. I am Dr. Nago. I'll give you subcutaneous injection. Okay? Wash your hands after gathering your equipment. Okay? Then you have to use special syringe like this, with short needle. After you gathering and washing your hands, you are withdrawing the drug. You withdraw the drug. I withdraw the prescribed medication like this. And then I have to recap it again. Choose the site of injection, sterilization from the middle, outside, a circular movement about 5 centimeters. Then remove the cap, hold it like this, and not from the plunger. Like this, you have to correctly hold it. And also in intramuscular injection. Then pinch the skin to elevate 1 inch fold of fat. Then 45 degrees on the skin, I have to introduce the needle at 45 degrees angle. Then you have to spray it like this, and then you have to inject and remove it in circular movements, and don't recap again. Okay? Don't recap and discard it. Okay? This is a revision on all the skills you have to do and how are the questions will be. Now, you will be divided. Ms. Angie will tell you your numbers and your skill lab, so as you can go inside and you make hands-on in about quarter to 20 minutes. Okay?